Hello.
Hi, how are you doing?
Good. What about you?
I'm doing good.
Could you introduce yourself and your background to our followers?
So my name is Ramon Berendes. I'm a 22-year-old physical therapist. I'm right now starting my own practice. We mostly focus on corona rehabilitation because corona is a big trend right now. So we're having a project running in which people can try to rehabilitate in 12 weeks and see how that goes for them. I'm also a personal trainer as well, and I'm a lifestyle coach. So I work in a gym where lifestyle is pretty much a priority. A lot of people who go there don't actually like to work out, or have never worked out. They don't know what to do. They feel like they don't want personal training, but they feel like they want to be able to work out themselves, but still know that they're working out effectively. So they come work out. We help them out either with food, either with what choice of things to be. They every month or so they have evaluation, see how it's going, and we need to change anything, and according to that we work further. So a lot of that stuff going on right now. Also looking at masters to see what I want to develop into as well. This is just mostly what I'm doing right now.
And what, in your opinion, are the most common mistakes while doing sports? Because you have experience in that area.
Alright, so it really depends on what kind of sport it is. If you're looking at, so a lot of people, especially nowadays, they look at going to the gym, doing a lot of stuff, and what you see a lot of times with going to the gym is people tend to do like overuse of their muscles, or either have bad form in which they get shoulder complaints, back complaints, and wrist complaints. The latter being a specialization within physical therapy, so I don't see a lot of those patients, but especially shoulder and lower back problems is a thing we see a lot, and that's mostly because of form mistakes. Now during when you see like looking at contact sports, it's mostly knee problems, also a lot of shoulder problems, but I think knees are the most we see right now. Because well, if you're playing soccer, or if you're playing American football or something like that, and someone jumps in at your knee goes the wrong way. I mean, so a lot of stuff like that.
And does a nutritional plan have some effects on our recovery?
Yeah, definitely. So it also depends on what nutritional plan you're following. Personally, I'm not an expert on when we're looking at nutrition, when we're looking at what it does to your body. However, I have a lot of knowledge about it because of the work I do, when I look, when I try to help people. So what is written in literature is that you see that when people are working out, their blood goes towards from their stomach, their vegetational system, towards their muscles. So what literally happens is your digestion, it stops, or not stops, it goes up to a minimal process. And what you see a lot of times is your muscles get a little bit pumped up, you get that pump feeling, and that process stops. But the moment you stop working out, you slowly start getting more blood towards your stomach, your muscles they lose their tension, and the recovery process begins. And what happens inside of the body, I mean, it's not 100% written on paper, but there's definitely evidence that when you finish working out, is that your body starts recovering, and what helps with that are proteins. So a nutritional plan can definitely help in that way, because what you see in a lot of researches is that when people tend to take within 30 minutes, that's the most effective window, a bunch of proteins after their workout, their recovery progress actually speeds up. So your recovery inside of your body, it goes up to an optimal point. So you recover more actually in that short time period because of those proteins, and it fastens up. So it doesn't really matter, from what I've written, if you take it beforehand or afterwards. From what I've seen, it's still like when you've just eaten before you're working out, I mean, it's like a brick in your stomach, so it's not that nice. So my preference always goes up to doing it afterwards. That's also what I tell to the people who work out with me, to the people who I see. I mean, try to get afterwards, try to get some protein. If that's just a meal, that's fine, but make sure there's something in it. Protein shakes are an easy way to get a lot of protein in a single go. So that's something I always advise when I see people struggling for getting some proteins afterwards. And then finally, there's always this saying that gains are made in the kitchen. No, it's actually, so 70% of actually your recovery process takes place on what you're eating. If you go to McDonald's or any type of fast food chain for 5 times a week and you're 7 times a week in a gym, I mean, yeah, you're gonna get bulky, you're gonna get a lot of muscles, but you're gonna get a lot of fat as well. If you take, let's say, the typical bodybuilder meal, which is rice, dried rice, chicken and broccoli, which has a lot of nutritions in it, it has a lot of proteins in it, and it has pretty much everything you need for a recovery meal, then it could be that you're still going to be lean, but you're still going to be putting on a lot of muscle as well. And that's the same thing for losing weight. If you don't change the way you're eating, you're never gonna, or not specifically change, but if you don't make any adaptations to the way you're eating, it's never gonna become the way you want it to be. Because you can work out as much as you can, but the line of burning extra calories is gonna flatten out at some point. If that were the case, then why is it possible to do extreme runs, and why is it possible to do extreme sports? Because your body, it adapts to the way you're working out. It changes to what you're doing at that moment. If you're really active, your body prioritizes that being really active. If you're not active at all, your body prioritizes that stuff.
And what are the effects of a bad lifestyle?
So a bad lifestyle, you have several factors which contribute to a bad lifestyle. So that would mean smoking, drinking, all your stereotypical bad food, food with a lot of fats, inactivity, and all that stuff contributes to what we call developing certain diseases. You get a higher risk of heart and artery disease. You get a higher risk of developing chronic obstructive pulmonary disease, which is actually called COPD in short. So you get those lifestyle-related diseases. You're also, your blood pressure is gonna increase. All the bad stuff, which you can pretty much think of, you're gonna get a higher risk of. And what the big thing with that is when people know because lifestyle is a big thing right now, but people only realize that their lifestyle is wrong 9 out of 10 times when it's too late. So let's say COPD. That's as soon as you have COPD, it's not gonna go back. I mean, the damage is already done, so your lungs are able to repair a lot. But as soon as you have that label of COPD, you're never gonna return to not being COPD. And it's the same for heart disease or artery disease. If you have a heart attack, you're not gonna go back to not having a heart attack, because that damage is always gonna be there. And that's a big thing which we're seeing right now, is because of also part of coronavirus, people seeing that they need to change their lifestyles. They're seeing that inactivity. I mean, you see so fast when, let's say you've gone on vacation for 2 weeks and you start working out again, you feel immediately that your body has gone to a lower level before. You're gonna be back on your old level in like a short while, but the effect of that is like actually really big. And if you get used to that being on that low level, I mean, you're not going to be knowing any better, so you think that's normal, but that's the big thing with people never having to work out. So as soon as they start working out, they feel that what they're doing is right for the body. You see that actually people saying they crave for more healthy stuff because they're working out. You see the mindset changes as soon as they start working out to something else.
But how do you stay healthy without forcing yourself?
So it's actually a good question. For staying healthy is always a hard thing because there's so much stuff going on the market right now. There's 100,000 of programs containing, and I think the most important thing for yourself is you have to find something in which you're comfortable with and which you don't have to think about. They say creating a habit It takes about 25 to 160 days, I think, which in general you could say it's like 60 to 80 days to create something out of a habit. So let's say going to the gym takes about 2 months before you're used to going to the gym, and it's not forcing yourself or not saying, all right, do I have to go to the gym today? No, I'm going. For actually, oh, I'm going to the gym today. That you're used to it. So for staying healthy when you're healthy already, I mean, it's all part of a balance. If you find something which you like, and that could be a program, but that can also be like a way of life that you're eating. Some people like to prefer to eat vegetarian. I mean, that's fine if they're comfortable with that. I mean, it's all about getting everything you need. And what helps with that is setting small goals for yourself. So what I do in my work is a lot of times when we see new people, we ask an acknowledgement number, we ask where they are right now. And let's say they're gone and busy for like 6 months. We ask them where they are right now. And a lot of times you see when people come in, they're at like 5, 6. If they're a little self-confident, they sometimes even say 7. And then we do a scan of their body, and they get a number out of there. So the scan they gives them a sign as well. And then they're like, now look at this. Now I feel like a 3. And then when they start working out, they set goals for themselves. So at the point, so when they start at the 3 and then they start working out, they start bettering their lives, they start bettering their lifestyle. They work out, and it's not that they're gonna create a 6-pack in over 3 months. It's gonna be that they're gonna go from their 3 towards their 7 or their 8 in like 6 months, and that's a good thing to see. But what the fun part is, as soon as you're at that 7 or that 8, for you that changes towards that 6, because you're used to it and you want to get better. People like perfection, so they want to go up, and then you ask them again, what do you want to go to? Maybe they say 7 or 8 again, or even a 9 or a 10. But it's like taking the small goals, especially when you're already healthy. Take something which you want to achieve, and don't set it for like 2 weeks. Take your time to get used to it. Take something which you know that you want to keep doing if you want to keep doing it. If you want to stay healthy, make sure you set a goal for yourself to stay healthy. Say, a lot of people say, I want to be running a marathon, and when they finish it, they're like, I already did that. What's my new goal? That's what I would recommend.
Thank you so much. Let's talk about injuries. What are the most common injuries among athletes, and what could help in prevention?
Alright, so like I said, most common injuries among athletes, it really depends on what the sport is. But what you see a lot, especially in amateurs, is a lot of muscle injuries. You see a lot of overuse. You see it can contribute to everything from difference in walking patterns. Let's say if you're running and you don't have an efficient running pattern, that can always contribute. If you're running a little bit more with your right leg than your left leg or something like that. But what you see a lot of times, people start working out without a decent warming up and they don't cool down when they're done. Then cooling down is even less important than the warming up part, because like I said just a while ago, is when you start working out, your blood goes towards your muscles. And what that happens inside of your body is your muscles become more functional because there's more energy inside, and your blood contains all types of stuff from building blocks to minerals to proteins, so all that stuff which need your muscles to activate. And what you see is, as if you take, let's say you take a high energy active exercise, so let's say you're going to go sprinting, when you're cold, your muscles aren't as functional as you can. And what you see a lot of times, because those muscles aren't functional, let's say they can't stretch enough, is you're going to get a small rupture, or you're going to get an overuse of something because that muscle is going to tension up too quick. It's actually fun to see how that works. Let's say if you're standing up and you're going to be bending over, try to reach your toes, and then let's say measure how far you come. Then take 4 or 5 squats and try it again. You're gonna see every time that you're gonna go forward. And maybe you can touch your toes at the first try, and you can touch your toes at the second time. You can try that at home. It's actually a really fun thing to see what happens when the blood goes towards your muscles, how it functionality improves.
That's gonna be a good challenge for our followers. Yeah, you already mentioned stretching, and a lot of people are actually underestimating stretching. In your opinion, which is the most beneficial for your body, stretching before or after a workout?
So even the stretching, there's like 100 ways to do it. From what I always advise my patients and my clients who I see, is you have two ways of stretching, which is important for them. You have dynamic stretching and you have static stretching. So dynamic stretching, you should put your muscle, let's say, in a tension position, and then you're gonna go bounce into it. And what happens inside of the muscle is the tension is gonna increase because that bouncing. You're gonna go extend all the way up and go back. So you're gonna go push that muscle out, which is gonna put up the tension. That tension is good when you're working out. So beforehand, definitely try some dynamic stretching exercises, get those muscles nice and warm, get those tension a little bit up, because what you see when you're working out, that tension is going to go up. That's functional tensioning. The tension is there for a reason, because your muscles work better that way. Like I said, your blood goes towards the muscles. But as soon as you're done, if you want to stretch, don't go into the dynamic stretching, because the tension is going to go up again. You want to make sure that the tension releases off your body, so that way when you're done, the tension releases, and as soon as you're done with that, the recovery process begins. So when you're done, definitely try some static stretching exercises, and that can actually be really easy. There's 100 ways to stretch every muscle, but the most important part is when you're doing it, don't just hold it for 5 seconds, really hold it for 20 to 30 seconds. Then repeat that process for 3 or 4 times, and what then happens is you get neurogenic adaptation. Super hard words, but pretty much what happens is that your muscle gets used to the position it's been put in. What also happens is when you're in the stretching position, make sure you breathe out all the way and you feel that you're gonna go a little bit further, and that's just because you relax when you breathe out.
Nice. And are you familiar with any innovations that can be beneficial for your body during recovery?
Definitely. You have there's a bunch of things going on. There's always coming on new products. I haven't tested out every one of them, so I can't say what the effects of them are, because a lot of them, I mean, if I bring out my own product, I'd say it's the perfect one as well. Everyone says that. Only you have a lot of nutrition plans, which I definitely recommend if you're standing behind it. Just make sure it fits what you do, and make sure you're not skipping anything. If there's a nutrition plan without eating a certain type of food, that's fine if you're okay with that. Just make sure you get all the macros inside of your body, so get all the proteins, get all the carbohydrates, get all the calories, all that stuff, get all the fats, because everything has a function. You also have, I think you have like a lot of bikers use those. You could put like there's kind of like sheets. You put those around your legs and then they float up. And what happens is the pressure increases inside of your legs, and it pretty much pushes the blood out. And what then happens is, as soon as the blood is pushed out and you put those off, the blood comes back flowing in. And like I said, the blood has every building block for your muscle. Let's say it goes to recovery. It contains all that stuff. So when there's no blood rushing in, that improves your blood flow, and that can contribute to, let's say, recovery.
Thank you so much for your answer and for a kickoff. And could you share with us your favorite quote that always motivated you?
What always motivated me is definitely finish strong. Just go ahead, just try it in your workout, just always finish strong.
That's the perfect end. Thank you so much.
Yeah, no problem.